Good afternoon, friends. In the continuity of the study of the anatomy, today I'm again discussing one of the bone of the upper limb, that is the radius bone. Okay, we discussed about the humerus, scapula, clavicle, all the upper limb bones, and in the same continuity, I'm discussing about the bone of peripheral side in the anatomical position in the outer side of a limb. Okay, when we discuss what is anatomical position, the hand are outstretched and facing forward, and the outer bone toward the thumb, this bone of the forearm, this bone is known as radius bone. Look at this bone. This bone is known as radius bone. Radial or peripheral bone. Okay, this is the radius bone. Now this bone articulates with the two another bone. Suppose this is the humerus and this is the humerus of this right side. This is articulating on this and participating in a formation of joint, rounded part, and this is also articulating with ulna bone. Okay, this ulna bone. Okay, this is articulation below. The lower expanded part articulate with the carpal bones. Okay, so this bone is the radius bone. Now because this is the one of the long bone, which is a bone of the forearm, it's having a characteristic feature of the long bone. And in general anatomy we discussed the long bone features are three border, three surfaces, three surfaces, two end. These are few characteristic feature of the long bone, typical long bone. And again, this is also one of the typical long bone. Now, but question number first arises, how we hold this bone in anatomical position. This may be a bone of right side, that may be a bone of the left side. How we are going to determine that whether this bone belongs to the right side of the forearm or left side of forearm. Okay, now we resolve the mystery. We can see there is a end where there is a rounded gnome-like part, and just below this there is a tuberosity. Okay, another part is more expanded part. This is the more expanded part. This is the lower part and this is the upper end. This is the lower end and this is the upper end. Look at this end clearly. This articulated with the carpal bones, this part articulated with the ulna, and this is the upper end or head of the radius. You can see this head of the radius is concave superiorly. It is covered by the hyaline cartilage, and up to this mark, this is known as upper end of the bone, this is the lower end of the bone. So then first of all, we have to hold the bone in a upper end, according to upper end and lower end. Okay, we are holding like this. Still we can manage to hold this bone like this on the left hand, but important thing is that when we holding this bone in this right hand of mine, this sharp border is medially directed. If I'm holding this bone in this hand, the sharp border is laterally directed. The sharp border is actually medial or intraosseous border, which should be directed medially. Second thing, okay, is still we can manage to do the both thing, that is upper end above, lower end below, and the sharp border medially. So what is third conclusive point? That the anterior surface is concave. Okay, this concave surface is anteriorly placed. You can see there is a dorsal surface, there is a concave anterior surface. Concave surface should be directed anteriorly. So very important thing, upper and above, lower expanded and below, the medial sharp border medially directed, the lateral bone intraosseous border is medially directed, the medial bone ulnar border, interosseous border is laterally directed. Okay, so second condition is medial border is, so this border, medial border is medially directed. Okay, medially directed. And third one is, and the concave surface is anteriorly directed. Okay, one more thing, this is the styloid process which should be directed laterally. In the arm, if I am holding like this, bone like this, styloid process is laterally directed. One more thing, there is dorsal tubercle of Leicester which is posteriorly directed. Okay, if you are talking about this expanded part, we can see there is a concave part and there is a convex part. The convex part should be directed posteriorly and concave part should be directed anteriorly. In such a way, we are going to hold the bone in anatomical position. Three typical terms should be remembered. Disc-like tuberosity and upper end should be directed upward. Expanded at lower end, expanded at lower end, and then concavity, anterior surface, convexity, posterior surface, and likely this styloid process laterally directed. When we 3 to 4 conditions are fulfilled, we can manage to hold bone in the anatomical position. So this bone belongs to the right side of my forearm, right radius bone. This is the right radius bone. Okay, now further discussion. We used to manage the bone holding in anatomical position. Now this is the upper end, and this upper end is articulating with humerus, capital part of humerus, as well as this is articulating with the ulna, a notch of the ulna. Okay, this is articulating with, and this is surrounded by a ligament. Suppose this is articulating with this notch, like of my finger, a ligament is encircling the hand, especially in the children. This head come out from this annular ligament, and usually the child present with a crying nature and hand in a prone position. The child is unable to supinate the hand because supination pronation occurring in the radial joint. Child is unable to supine the hand. His or her hand is in child's hand is in prone position and continuous crying is there. That condition, when the head is pulled out from the annular ligament, that is known as pulled elbow. Okay, the neck is there. Partially the neck is also covered by the annular ligament. Then there is the radial tuberosity. A frequently asked question, show me the radial tuberosity, and this is the radial tuberosity. If you can see to this radial tuberosity, we are able to find out that the posterior part of the radial tuberosity, is rough, where there is an insertion of the bicep brachii muscle. And anterior part is smooth, which is covered by a bursa, so that the twisting fiber, when working on this radial tuberosity, unable to contact with the tuberosity, and there will be less friction. Bursa is anteriorly placed, and posteriorly there is an attachment of the tendon of the bicep brachii. I want to tell you, this is a frequently asked question: where is the radial tuberosity and what structure is attached on the radial tuberosity? Okay, then below the radial tuberosity there is a ligament also, which is actually a toughened part of the interosseous membrane. From this medial border up to the interosseous border of the ulna, a membrane is attached that is known as interosseous membrane, and this membrane that is known as interosseous membrane is supposed to be intermediate radioulnar joint also, and this membrane is connecting the radius and ulna and dividing the forearm into anterior compartment and posterior compartment. Now, a very important question we frequently ask: where is the oblique line? Look at this one. From the anterior aspect of the radial tuberosity, a line, you can see this is the line. From the anterior aspect of the radial tuberosity, this is the line which is tilting and going like this. Look at this. This line is known as anterior oblique line, and slowly this anterior oblique line is converted into a border. Look at this, is converted into the border. Anterior oblique line then slowly going to merge with the border, which is ending on the styloid process, anterior aspect of the styloid process, and anterior aspect of the styloid. So one border we know, that is the medial border, that is also known as styloid border. This is the interosseous border, and interosseous border below is bifurcating and forming a triangular space. Look at this one, triangular space. The medial or interosseous border, which is bifurcating and forming a triangular space there, where the D, okay, this is the space, and this is known as anterior oblique line, and anterior oblique line continuous into anterior border. Okay, two border are well demarcated. One is the anterior border. Look at this one, from the anterior oblique line a little bit laterally placed, where this border is known as anterior border, and a medial border which is supposed to be the interosseous border, which is bifurcating and giving rise to a triangular zone. Okay, that is medial border, interosseous border, anterior border, continuation of the anterior oblique line. When we are looking toward the posterior aspect, again there is a posterior oblique line from the radial tuberosity, but there is a posterior oblique line, there is a posterior oblique line, there is a posterior oblique line, but the posterior border is not well demarcated and it is feeble. It is only can be seen in the middle of the bone. Look at this one, it can be only prominent in the middle of the bone. In the lower part of the bone it's not well defined, neither in the upper part of the bone, okay. So posterior border is well defined in the middle third. Again I'm holding bone like this one. Three borders, the medial border, interosseous border with sharp border below bifurcating to create a triangular zone. Anterior border above continuation with the anterior oblique line. Always remember the anterior oblique line and posterior oblique line arising from the root or the lower part of the radial tuberosity. So these are features, and there is a notch below just medial to this triangular zone. This is the concave aspect of the lower end. The lower end of the radius having 5 surfaces. This triangular surface below notch is there, carpal, anterior surface, posterior surface is there, and the styloid process is there. So anterior, posterior, the medial, styloid and lower surface. Total 5 surfaces of the lower part of the radial bone are there. So with the help of this interosseous border and the anterior oblique line and anterior border, this is divided. This surface is known as anterior surface. Between the posterior border and the anterior border there is a lateral surface, and in between the posterior border and the medial border the surface is known as posterior surface. These are surfaces of the radial bone, So we will continue our journey for the attachment on the different part of radial bone in a next video. Thank you.